Hi, I'm Dr. Elizabeth Zhang, an ophthalmologist and oculoplastic specialist. So one question I get asked a lot by my patients is what are floaters? So floaters are typically what people describe as little black dots or spots that kind of float around. And some people, see them as like flies or like gnats and may actually like, kind of swipe at them. But they're actually not out in space. They're actually just something you're seeing in your eye. So what it comes down to is there's something in the middle of the eye called vitreous. And when you're first born, the vitreous is like a solid piece of clear jello. Then during our lifetime, our eye actually constantly produces fluid and the fluid drains away. And this is how you keep an even pressure in your eye. So that fluid mixes in with the vitreous. And so the vitreous becomes more of a like marmalade consistency. Over time, that jello also starts to shrink in size. And so eventually it starts to pull away from the back of the eye where the retina is. The retina is the lining at the very back of the eye that actually detects light and vision. And sometimes when it pulls away from the retina, it might pull away some of the pigment, or if it pulls away from around the optic nerve, may pull some fibers away. And so now those are now um, floating around in the middle of the vitreous. And so those can be seen as floaters. Sometimes it's possible that maybe clumps of the jelly where it's more thick or dense versus other places where it's more fluid, that could be seen as potential floaters as well. So when do we worry about floaters? Well, if you've got a burst of new floaters, like 20 new floaters all at once, we worry that maybe the vitreous pulled a little too hard on that retina and actually caused a little retinal tear. If there's a little tear in the retina, now that fluid that's in the eye can now get underneath that tear and then actually lift up the retina and cause a retinal detachment. So if you see a burst of new floaters, like 20 new floaters all at once, or you see any curtains or shades in your vision, so like you cover one eye and suddenly half the world's gone or part of the world's gone, or you kind of see like this flapping thing in the periphery of the vision, that's a time when you want to actually get in for an emergent ophthalmic dilated eye exam, so we can actually look if there's any retinal tears or if you have a retinal detachment. If you do have a retinal detachment, then you want to get that treated right away. If it's a small retinal tear, you'll also want to get that treated, though it's a little less urgent. If you just have one or two new floaters, that's probably really not an issue, but definitely if you are seeing flashing lights, lights that you see with your eyes closed, some people describe them as lightning bolts or like a lamp that's constantly going on and off, then you also want to get in to see your ophthalmologist in order to actually just make sure that there's no tear and everything's looking good at the back of the eye. If your retinal actually detaches fully from the back of the eye, that really can cause a significant decrease and possibly full loss of vision. So it's something not to take lightly. Another thing that can cause different lights in the eyes are ocular migraines. And those you'll typically see in both eyes, whereas these flashes you'll typically just see in one eye because it's unusual for this to happen exactly at the same time in both eyes, though not impossible. So I hope that answers your question about what are floaters and a little bit about what are flashes. Uh, if you have any concerns, please call your local ophthalmologist, or if you're in Cleveland, Ohio, I'd be happy to see you.